We have learned over the years that physicians are creatures of habit. They tend to do things the same way over and over. We also know that they should be focused on patient care and not worried about billing.
What we believe is doctors need to be doctors. They need to be free to take care of patients, and we need to empower revenue cycle teams to deal with all of the headaches that are caused by the payers, empower them to make sure that claims can get paid completely and correctly the first time.
Different insurance companies have different rules, and it's really hard for someone in a billing office at a physician practice to have all that knowledge stored in their head. So they have sticky notes and they have manuals and notebooks.
Capturing this revenue is one of the hardest things to do. If you knew what you were missing, you wouldn't be missing it. Two main parts of improving revenue cycle outcomes are productivity for the staff and then the actual outcome on the back end. Many practices do a great job with their outcomes. They have a very low denial rate, they have a very low mischarge rate, but they're spending a lot of staff time to get those results. Those types of practices, they need tools to automate the process. Other people don't invest a lot of time in the revenue cycle process, but their results are not as good as they'd like them to be. Their denial rates are high. They're spending a lot of work on the back end rather than getting that right the first time.
One of the great advantages of the White Plume products is that they can be completely customized to our clients.
So instead of the individual person having to remember and catch those things, our software will catch it for them.
There are many hands that contribute the information that are required for accurate billing in a medical practice. Excella Capture allows each contributor to add what they want, when they want, without having to rely on the patient or a paper ticket being present.
One payer may want the exact same visit coded differently than another payer. And unfortunately, a lot of people are trying to turn doctors into coders. And that's not what they're best at. That is not why they went to medical school. And that is not going to create the best revenue cycle outcome. So when we say we want to improve revenue cycle outcomes, when practices ask us to help them with that, there are typically two different areas that they want us to work in. Number one is making their staff more productive. If they can take a revenue cycle employee who's processing 40 encounters an hour right now, our average users are able to process 78 encounters an hour. They can be much more efficient. And our superstars, the best users of our systems, can process up to 148 encounters in a single hour. And that allows them to get more done in a shorter period of time with less resources required to do it.
So our system is built on an exception basis, meaning you only have to stop when there's a problem. So obviously you can go much faster if you aren't reviewing clean claims.
We can catch things that a doctor might miss on the encounter. So say the doctor marks a drug that they've given the patient, but they may have forgotten to also include the admin charge, the charge for administering the drug. Or they may see a patient for a fracture and they forget to mark the casting equipment that they've used. And so we've built rules into the system, or we'll allow the customer to build rules into the system that will catch that say, hey, you did this, but did you also do this?
They can see the error and make the correction on the same screen before those charges ever get to their practice management system. That way, when encounters are posted, they're posted completely and correctly the first time. That is what allows them to process so many encounters so quickly.